Hi, and welcome to this presentation where we will be looking at a program that explores strength for living. First of all, it's important to recognize that movement is safe even when we're experiencing a persistent pain problem. We know that persistent pain is not a good indicator of ongoing damage, and we have other modules that explore the acute and chronic pain model, which you're welcome to look back on in that respect. The model that we work on is around an increased sensitivity of the nervous system, so the brain, the spinal cord, and all the nerves in the body that are supplied. It is unpleasant but safe to experience pain when we are exercising. So that's the important thing to remember. It's okay that pain may be part of your experience. We do know that pain as a function is there to help us keep us safe, and often therefore avoiding pain may be the way that you approach movement and exercise. And again, this is helpful in that acute pain setting, but less helpful with persistent pain. We know that if we avoid normal movements, normal behaviors, that actually this can go on and contribute to more pain and more sensitivity. So if we explore the effects of being less active with persistent pain, firstly on the body, so we have muscle weakness, joint stiffness, tiredness and fatigue, lack of energy. Bone health can change. Our cardiovascular fitness and risks of other health conditions form very much a part of being less active secondary to pain. How does this translate into that person's life? Well, if they're not moving and not active, they're going to be less social. They're going to start to struggle in certain situations. They'll have lower motivation to stay engaged in things that are meaningful to them. They'll have less confidence to go out and do particular tasks and activities. And this manifests itself with lower mood and poor sleep and fundamentally more pain. So you may have seen this slide before, this pattern of over, under, or boom and bust activity cycling, as we call it. So what this represents is on a good day, we might push ourselves, increase our activity levels, try to get things done we haven't done in the few days before. And the consequence of that is often suffering and experiencing a bad day. And this cycle will tend to manifest itself over time, good and bad days. Gradually, though, the ability to push on a good day is less. The time it takes to recover on a bad day extends. And overall, we see this sort of negative spiral in our ability to maintain that activity. The orange line, this is changing nothing and doing nothing. So if we continue to avoid our activities and stay away from exercise, gradually that activity level will move again in that negative cycle towards being able to do less. And what we're really looking for is this green line, this pattern of slow and steady, gradually increasing our activity levels, whether that's exercise and activity, moving towards a better function, better physical capacity, a better physical life and health. And this is based on a plan and less about how pain is. So there may be some days when pain is present, but we would still be encouraging you to move towards something, do some level of activity. So what happens if exercise stirs up my pain? Well, we know that in people that don't have a persistent pain problem, that if they're overloading their muscles and exercising frequently, then it's quite common to experience pain and soreness. This is very normal. And in the scientific world, this might be known as DOMS, or delayed onset of muscle soreness. And this is a normal response when a tissue is stressed, that they might experience what we call microtrauma, and that triggers an inflammatory response, and that will bring about growth and repair and recovery, but also the chemicals that come along in that situation will bring about some soreness, that sensitivity of the nerve endings. If you've been active for a very long period of time, going back to activity, you'll find that this process of delayed onset muscle soreness can be amplified. But the more we practice, the more we train, the less likely this DOMS is to affect us. What we do know with people that experience persistent pain and a sensitized nervous system, that this amplification can be felt even more so than perhaps people who don't have a pain problem. So what is normal? What should we expect as we return to exercise and activity? So during the exercise, we may find that the pain increases or decreases, or it may stay the same. We'll probably feel a sense of achiness or tension and stiffness. We may even experience clicking or clunking or noises in the joints or other muscles as we move, and in most instances, this is perfectly normal and it's not causing any harm or damage. We'd expect the muscles to feel tired and have less ability to do sort of lifting if you've been working them. We expect our heart rate to go up, and we might expect our respiratory rate to go up. So normal physiological responses during an exercise or vigorous activity. What can we expect after exercise? A sense of satisfaction and achievement and well-being. That feel-good factor. So for runners, runner's high is something you might have experienced or encountered before. So our body will release natural endorphins and feel-good hormones and chemicals that make us feel excited about the exercise. We know that muscle soreness will begin to reduce with regular exercise. And you may even find a sense of increased alertness and concentration, and potentially a deeper sleep as your body seeks to recover from the workout that you've been doing. A great motto that we use is sore but safe. So we know that movement and exercise can bring about soreness, but we also know that it's safe and healthy to do. So where might we start? So setting ourselves a SMART goal. And what does that mean? So first off, the S in the SMART goals. So specific. This is picking a task or an exercise that you want to embed into your routine. This may be Pilates, yoga, or strength and conditioning. We have further videos that can help get you started with these exercise practices. M stands for meaningful. So you're looking to choose something that's going to add value into your life. Finding an exercise or an activity that you can do with friends or loved ones, but really something that's going to give you some purpose and something you want to do and love to do, rather than something that social media tells us we should do. It should be adaptive, so something that's going to change your life, move you forward in this chronic condition. It should be realistic, so we need to start small and build slowly and move at a pace that works for you. Everybody is different, there isn't one size that fits all. And T is for time bound. So set yourself a day and a time that you want to achieve this by to keep you on track with this. And most of all, enjoy it.